Good morning. The devilish LCA. I want to start this morning by just going over some general process issues. You've been asking a lot of questions during the week about numbers and exactly how the situation is operating. So I want to start by going through the protocols that we are following, and hopefully there'll be clarity across the board. Where we have organized in an emergency management system response capacity. When you have a statewide situation that requires immediate government action and coordination among different agencies with local governments, that's our emergency management system protocol. We have a New York State task force that has been working on this, which has obviously been interagency. These are the members of it. Some of them are here with us today. You see who's on it, who's not. Rob Mejica is not on it. He's been focusing on the budget. Three basic areas that we have been operating on. The testing priorities, quarantine, and containment tracking. And we'll go through them quickly. On testing priorities, first priority for testing is people who have been in close contact. We define close contact as within 6 feet of a person who is known to be positive. Second, people who have traveled to a country with level 2 or 3 travel health notice from the CDC and is experiencing symptoms. Third is a person who's in quarantine and has developed symptoms while in quarantine. Fourth, a seriously ill individual who has not tested positive for other viruses. So when the person has gone into the hospital, they run the viral screen, doesn't test positive for any other viruses, then test for the coronavirus. Fifth, any other case in which, in the opinion of the healthcare professional and the local health department, they believe requires testing. So they would call up and consult with the Department of Health on that one. Quarantine, there's two types of quarantine. We keep going back and forth between the word quarantine and isolation. Let's say they're basically synonyms, but isolation is the technical word. So it's really mandatory or directed versus what we call precautionary. Mandatory quarantine, anyone who tests positive, anyone who has been in direct contact with a person who's tested positive, anyone who's returned from a country CDC level 2 or 3 and is experiencing symptoms, any other person who their health professional and the local health department believes needs to be quarantined, and they'll speak to DOH to make that determination. That's mandatory quarantine. Precautionary quarantine, you return from a country with CDC level 2 or 3, but you are not symptomatic, okay? That's precautionary quarantine. Proximate to a person who is positive. Proximate, not direct. Direct is within 6 feet. Proximate exposure is, I was in a car with a person, I was in the office with a person, etc. Third, any person who the local health provider and the local health department thinks should be quarantined, and again, they'll consult with New York State Department of Health on that. The last system that is operating is containment tracking. We're mapping all these cases, we're analyzing them, we're investigating them. Every time you get a positive, you run that case back to see who else could have been infected, and we are communicating that. The number of precautionary quarantines is at 4,000 statewide. You can see the list there. It's basically all across the state. Obviously heavier in New York City and in Westchester. 2,700 New York City, 1,000 Westchester, and then 115 Erie, 70 Nassau, Tompkins 15, Suffolk 15, Albany 11, Broome 4, and you can go right down the list. Schenectady 12, Warren 6. Mandatory quarantines, 44 statewide, New York City 9, Westchester 33, Erie 1, Nassau 1. In terms of new cases, yesterday we had 22 cases. Today we have 33 cases, so it has gone up by 11. There is one new case in New York City. That is a case where a person is tested positive. It is connected to the Westchester case. 3 members of the Young Israel congregation connected to the Westchester case. All of the new cases are connected to the Westchester case. 2 friends, 2 people in Rockland County who worked at the bar mitzvah, and 3 patients, 3 people connected to the visit at the Lawrence Hospital. That brings, those are 11 new cases, 22 goes to 33. Just a general context question. The number will continue to go up. I've said every day the number will continue to go up. The number must continue to go up because it is mathematics. The more you test, the more positives you will find. And remember, we're predominantly testing people who have a higher probability because they're in the chain of contact with a person who has already tested positive. So people see the number go up and they say, oh, the number's going up. The number has to go up. The number can't go down, and the number has to go up because we are testing people, because we want to find people who are testing positive. That's how you contain it. Find a person who's infected, quarantine them, and reduce the infection rate. That's what it's all about. Also, some of the news stories sum up what I have been saying to say, Cuomo urges calm. I'm not urging calm. I'm urging reality. I'm urging a factual response as opposed to an emotional response. I'm urging that people understand the information and not the hype. We have more people in this country dying from the flu than we have dying from coronavirus. All the experts say 80% will self-resolve, 20% may get ill, may require hospitalization, and it's most problematic for senior citizens, people with immune-compromised situations, and people with an underlying illness. The fact of our own experience, okay, I don't believe anyone, okay. The fact of our own experience, we have 33 cases. 5 of the 33 are hospitalized. 5 of the 33. That's about 15%. Verifies the about 20% may be hospitalized. Of the people who have been hospitalized, they are improving, right? So those are the facts. What are we concerned about? Senior citizens in congregate facilities, people with compromised immune systems, those are the populations that are most affected by the normal flu. That's why I go back to what I said to my brother. This is like a flu on steroids. You catch it the same way. The target population who's most vulnerable is the same. You take the same precautions. And Dr. Zucker, every flu season, says to me, you should tell people don't shake hands and don't hug them. Why? Because because that's how you communicate. Use hand sanitizer. So it's the same precautions, it's the same issue. Look at the facts. Look at the facts. I know this is a great issue on all the TV stations, and everybody has an opinion. Look at the facts. If you look at the facts, facts dictate calm. Question?
Governor, I'm wondering how many tests has the state actually performed at this point? I know, Doc, you said the capacity was about 100 a day. What's the total number we've done?
I'd have to give you the exact number. I'll give you the exact number.
Do you have an estimate? Are we talking thousands?
No, we've done dozens of tests.
Dozens?
No, more than dozens. Let her get you the exact number.
The exposure, obviously, these cases continue to go back to the folks in New Rochelle. It seems like there's a doctor who is one of them. I know you don't want to get into specifics about people, but there seems like there's a doctor. Can you talk at all generally about the exposure in that case, and whether there's concerns that this doctor might have treated patients who are, then that leads to a whole other set of questions?
I think the way to look at this is, as we've been saying, this community spread. So you can deal with a community, whether it deals with a school or whether it deals with an office or it deals with a family. And so, not to get into the specifics, this is why we go back and we track this to try to find out how close was someone, how far away were they, are they somebody we need to follow up and test further.
Yes, what do you do at Metro North, right? I mean, we know the lawyer, the first one, he traveled on Metro North. How do you start, when do you start going back and see what train that person was on? They were on an 840 train from New Rochelle to, Grand Central Station, stuff like that?
Well, a couple of points here, Joe. First, remember, we are learning more, we're more educated. So healthcare professionals, for example, doctors, nurses, et cetera, they're in a different situation than they were, they're in a different situation today than they were 10 days ago or 2 weeks ago, right? When nobody even thought to think about this when somebody walked into the office. So now fully informed. Second, you test and track every lead you get. That's basically what you do. And we're looking for positive results because that means we have identified a person that can protect other people from the infection. The lesson to me on New Rochelle is how you can, in a gathering, a number of people can get affected, just like the flu, by the way. But you can have one large gathering, 400, 500 people in a gathering, and you can infect a number of people. So for senior citizens, if you are cautious about going to a gathering, you go there today, Joe, you may get the flu. You go there today, you may get coronavirus. And it's 80% it's going to self-resolve if you're not a senior citizen, if you're not immune compromised. On the facts, would not.
That's so.
I don't want to give out specifics to any patients or any individuals. Well, that would be identifying a specific person.
Oh, hundreds, Jesse, hundreds. Because you have the State Department of Health, and then you have local departments of health being coordinated by the State Department of Health. There are done basically, there are monitoring requirements if you're under mandatory quarantine. That means one person, there will be a daily random in-person check that you are in your residence from a health official. But there were only, what did we just say, 44 cases? Mandatory quarantine. So it's not a tremendous workload. Also remember on the, we're balancing, I'm trying to communicate facts because the facts would make people calm. The reality is not frightening here. But there is an undue anxiety, so we're also trying to address the undue anxiety, and we're taking a lot of precautions. Like you mentioned Metro North. We're disinfecting trains, Metro North, he's doing it. So some of this, in retrospect, you may wind up saying, you know what, you did all of this work, and the ultimate consequence wasn't that bad, which, by the way, is what I think is going to happen. Be saying, well, why did you do all that if the ultimate consequence was going to be that bad? And, you do what you need to do in the moment, and we believe that we're reducing the spread. Even if you're only home, 2 weeks quarantine, it's not good for them and their family.
Confirmed as housing facilities for people.
That we have done decisions yet.
Not necessarily specific facilities where we know that individuals are going to go. What we've done is we've identified available resources. So we have identified available resources at a number of campuses. There are resources at Brockport, resources at Buffalo State, resources at Stony Brook. But what we are in the process of doing right now is contacting all of those individual students overseas and determining whether or not they have an option for quarantine, precautionary quarantine at home, or whether they will need to use a facility.
Governor, how would you characterize your relationship right now in communicating all of this with local governments? I know there was a dialogue with your office and Erie County Executive Mark polling cars over identifying, where people are, things like that. How has that relationship been going so far?
I think it's very well. When I visited the localities and the local officials who have the highest number of cases. It's a case of impression for everyone. We have not done this before, this mobilization on the public health system. We have done statewide mobilizations on floods, hurricanes, terrorist activity. This is the first real public health mobilization. So I think everybody is feeling their way a little bit, and you have a tension between the public to calm the public, because I believe the more facts they understand, the calmer they will be. But you also have privacy laws and HIPAA laws, and that's why Dr. Zucker is exercising the caution that he has to exercise. It's not a discretionary call because the privacy laws are real. But I believe that this state has the most organized, intelligent, effective response. But you're learning something new every day.
Ridership on the subway or the commuter rails?
Not that I've heard.
Governor, speak to accommodations and for